All right. Nicole, was there anything you wanted to say to kick us off, or you just want to dive in?
Just that we're going to start with the community impact dashboard this time. There's been some edits to it, and so I think it's pretty exciting to show it. And that way we might have a little bit more time. I have heard from several of you, it is nice, right? Well, I don't know, nice is the term, but the COVID numbers are looking a bit better than they ever have in the past few weeks. So they are headed down. And we can still look at that. And I'll put it in the chat box where you can also look at the COVID data. But we thought we would start with the community impact data, which sadly is not looking very good. But I'll go ahead and put in the chat where the COVID one. So if you want to look at it, just in case we run out of time. That's it. That's all I want to share.
Okay, great. Yeah, so this is, for those of you who don't know me, I'm Mike Reich. I'm with Data Contours. We've been partnering with the North Sound on data modeling, and as Nicole mentioned, the COVID forecast, as well as this new community impact report, which we'll talk over today. So I think you guys have seen kind of prototype versions of this. This is the final beta I'll show, and would love feedback. I think last week we followed up with some questions around specific indicators that would be useful. For those of you that are embarking on needs assessments, we've sort of tailored this in some ways, thinking about what you may require. So we will be continuing to update this with new data, new indicators based on feedback over the next couple of months. So as we dive in, feel free to put that in the chat or talk. That can very much be a discussion. So I'll kind of walk through what this looks like, but this is also available at this URL for now, and then we'll move it over to the other URL that Nicole posted in there. But you can take a look at this. A couple of rough edges that we're still working through, but should have the data and all the methods and everything up by the end of this week. So, so for those of you that don't recall or that are new, the goal behind this has been to fill in some of the gaps around current data, specifically community, social determinants, health impacts, some economic and poverty measures as well. The big challenge with the COVID stuff and all of the associated economic impacts is most of the community data that's publicly available from the common sources like ACS or CDC are pretty out of date, especially when it comes to some of the social determinants. And the other side of the coin, what we wanted to begin to do was provide some scenario planning tools for folks to be able to calibrate both over the next 12 months, but also some of the longer time horizons with some of these health impacts. You know, if things don't change now, what potentially could the long-term impacts be? So I will walk through this today because this has got updated numbers, and then happy to answer any questions. And if we have time, we can touch on the COVID stuff as well, as Nicole mentioned. So the report itself is divided into some different sections, specifically people with some demographic breakdowns, work and employment, poverty, health, and determinants. What I'll show today is for the North Sound as a whole, which is the 5 counties. Right now we have data as well for Snohomish and Whatcom counties, and we'll be loading in for the remaining 3 as well this week. And some of the numbers may change slightly. There are some slight variations with what you may be familiar with, but overall it's pretty well locked. So we have a people section, which is helpful to provide demographic breakdowns, as well as some of the breakdowns around population characteristics like disability. We'll be adding in education level or educational attainment, but curious if there's any other kind of population characteristics that would be useful for folks. A lot of this you're probably familiar with. The fun stuff starts on the work and employment tab. So we use kind of a three-step model to project out. So the first is looking at employment characteristics, specifically employment by industry sector within the region. So the first section here you'll see is a breakdown of over time, where is the employment by sector within the North Sound. The largest employer is manufacturing. Historically, with about 70,000 people, the historic unemployment rate estimated for North Sound as a region would be 3.3%. So quite low. This is as of 2019. And then total employed population is about 500,000. The second and third sectors by employment are healthcare and social assistance at 70,000 and retail trade at 59,000, and then it starts to tail off after that. So important to note, because these two categories do have seen significant impacts because of COVID shutdowns. So this employment model and our estimates for current unemployment rate and then projecting out into long-term and short-term poverty are based off of apportionment of the weekly UI claims data. And so this is a population-weighted apportionment that we do on the state data. So the estimates would be continuing claims right now at about 65,000. Initial claims have stayed pretty steady, but we're starting to see slight variations. The big question is kind of, we'll talk about in the scenarios, how do these continuing and short-term initial unemployment claims change over time? The key distinction here, a couple of key things to pop out. We've talked a lot about the unprecedented scale of what communities are facing, especially around employment and poverty. This is a great example. Currently, as of today, the initial UI claims data is about 150% what it was at the beginning of the year, and the continuing claims are up about 330%. So, 1 to 3 times the usual number of people that we would expect to see on unemployment. We divide up unemployment into long-term unemployed and short-term unemployed. And the big question is going to be how many people are able to be rehired and move out of short-term unemployment back into employment versus how many people shift from short-term unemployment into long-term unemployment. Long-term unemployment being defined as out of work, but still seeking a job for longer than 27 weeks. That 27 weeks is important because that's usually the expiration of the UI benefits. The thing that everybody is concerned about is, on about end of July, the federal supplemental UI payments stopped. And so this number held a lot of people from going into poverty who now are falling into poverty, even if they're in short-term unemployment, because the UI income does not match the previous income that they were making. So based on this claims data, we drive some sector-specific estimates of unemployment. So we would put the region-specific unemployment rate at 8.9%. And again, last year it was 3.3%. So we've seen about a threefold increase in unemployment. It comes out to about 49,000 people in the region. That's 49,000 jobs lost since the beginning of the year. And then we've got some tables that are sector-specific breakdowns. For the North Sound in particular, what's interesting is this is a lower number now than we see nationally, and that's because the manufacturing proportion of the employed population is so high. And manufacturing so far has seen limited furloughs and layoffs, though we would expect the longer this goes on, and especially given the manufacturing sector in Washington is based on largely, at least in this region, around Boeing and Boeing subcontractors and vendors, that there's some impacts that will begin to feel in the region in the 6 to 12 month range. But overall, in the short term, where most of the layoffs and job losses were focused on retail, trade, healthcare, accommodation, and food services. And you can see the unemployment rate for each of these within the area are different and higher. So this was all modeled based on the North-Sound characteristics, but we are using the state apportionment of the UI claims by industry. So this is pretty accurate. So what are the implications of that? There's a ton of data. We're not going to be able to cover it all today. So I'm really curious if the feedback as you all are able to kind of take a look and dive in. We model 3 different scenarios around economic recovery and employment and use those models to drive estimates around poverty and estimates around long-term and short-term outcomes. So the worst case estimate we have for unemployment would be what we call the worst case scenario. And this is essentially assuming we see in the fall the shock that we saw in the spring. So we would see a doubling of the current unemployment level. We would see no economic recovery beyond the end of the year. So we reach a peak around the end of the year as the economic effects trickle out. And then it stays at that elevated level as there's no short-term economic recovery. So what would this look like in the Sound? It would be about a 25% unemployment rate and overall about 300,000 people unemployed. We then model what a likely scenario is, and this assumes continuing COVID presence, some amount of government stimulus, some economic recovery, but moderated and sector specific. And then after the end of the year, as a vaccine becomes available and more widespread and the economic recovery picks up steam, we see the unemployment rate decrease to end the year at about 10%. This seems to be kind of where economic forecasts have aligned, maybe starting to decrease over time. We'll see kind of where that changes, but around that 10% in the next 12 to 24 months seems to be the consensus. So the reality in the North Sound would be about 129,000 people unemployed at 12 months from today. And then the best case scenario would be, this is the worst of it. We are going to see the recovery pick up steam. COVID largely goes away. The trends we're on today continue in decreasing infections, and a vaccine becomes available, but largely unnecessary because all the other interventions are working. So what would that look like? Well, we would see the unemployment rate at about 5% for the region, still elevated because there's been some residual economic damage done over the last 6 months. So we won't return the unemployment rate down probably until the 4 to 5 year time frame, but we would see it recover to pretty close to what the historical mean has been. And so that would be 5.1%, about 61,000 unemployed. So there's a lot there. Going on to the next section, which is what are the implications of long-term unemployment on poverty? And the challenge with long-term unemployment is you're unemployed in the long term, which increases the likelihood that you fall into poverty. We use the census definition of poverty, which is the income-derived poverty level, not factoring in savings, non-income cash payments, et cetera. So there's a bunch of different ways you can look at poverty, but we decided to use the census definition. So we'll walk through kind of what the historical poverty situation has been, what the current rate is, and what the projections are. So the historical data as of, or the latest data available from ACS would be 116,000 in poverty, which is about 10%, 9.7% for the North Sound region. And over time, it's been improving. So since 2015, in the last 5 years, we've seen a decrease of 16%. People in poverty. So trends going in completely the right direction. This mirrors a national trend from about the mid around 2014, 2015, seeing the poverty rate improve.
Mike, did you?
Greg, that's a great question. I did. Yes. So yeah, both the likely scenario and best case scenario assume an effective vaccine by the end of the year, and then a period of uptake over the next 12 months or so. But effectively, shifting away from shifting the burden from policy interventions, public health interventions, from suppression to vaccinations. And the best case scenario, actually, sort of the vaccine's irrelevant. Best case is we don't need a vaccine because people are wearing masks and washing their hands and doing all the things that will help contain the virus. So it's an optimistic scenario intentionally. Okay, so what are the implications on the poverty rate since last year? So just based off of the unemployment numbers that we've seen so far, we would estimate that the poverty rate is 11.7%, almost 12%. So up about a third, and that would be about 23,000 new people in poverty in the region since January 1st. And so a big jump immediately. We're back to basically the peak of where poverty has been for the last 10 years in the last 6 months. So what are the implications if we carry those economic scenarios through over the next 12 months? What are the implications for poverty? Again, we have in the worst and likely scenario, an increasing unemployment rate or an increasing long-term unemployment rate through the end of the year. So we would expect with the worst case that poverty peaks at about 15%. And that would mean about 68,000 new people in poverty in the North Sound, which is about a 60% increase over the historical level. The likely scenario would put the poverty rate at about 12%, which would be almost 30,000 new people in poverty, which would be about a 25% change. Best case scenario, we see about 12,000 new people in poverty. The poverty rate is at about 10%. And slightly, again, assuming best case economic recovery, slightly worse than it was prior to all of this because of the long-term economic damage, but we still don't revert back to the mean for a couple of years. Okay, so based on poverty, there's good evidence that shows poverty and income and employment, all sort of as representing the same thing, are probably the most important social determinant of health, and also related to a lot of the other social determinants. So one of the things we wanted to do was begin to provide some estimates around what the potential long-term and short-term health impacts are based off of these poverty models, and then the same in the near term, what are the potential impacts on social determinants and long-term. So in the health model, a couple of things. So we have different indicators. We have 4 indicators on the health model right now, and 3 indicators that we're using for social determinants. We're continuing to add out as we're able to source data and develop the predictive models for each of these. So what we've tried to do, just to calibrate everybody, is provide a little bit of a score against these projections. We have 2 criteria. The first is kind of what our confidence is in the model. And this is based off of the evidence and research that shows a relationship between the two, between poverty and some of these health outcomes. The second is North Sound specific data quality. So where the data quality is good, where it's medium, where it's bad. And the North Sound is challenging, as you all know, from a data perspective, because so much of the area is rural with small populations within this data. There obviously are omissions and suppressions because of that. And so that leads us to have sometimes a lower confidence, especially where the data is very spotty in the projections because we just have less data to model from. So you can see the scoring is kind of consistent throughout here just to help you all understand the context. So what might we see? And again, we think of these scenarios as guideposts, not predictions of what will happen, but under each of these different scenarios, what might the short and long-term implications be? So within heart disease, under the worst case scenario, we would expect to see a 60% increase in heart disease incidence within the population, which would be about 36,000 additional cases over the next 10 years. If we're in the likely scenario, it would be about a 22% increase, which would be 13,000 additional cases over 10 years. And then the best case would be about 5,000 additional cases, or about 8%. And we see kind of a long-term reversion to the mean on the best case scenario. It's a little harder to see on the worst and likely. We can look at cancer incidence. The confidence on this is medium because this indicator is a collection of a lot of different cancers, and obviously there's variability in the relationships and causal factors between those. But at the population level, medium confidence in this indicator. Data quality for cancer data is also medium, same challenges with all this health outcome data. So we would expect a significantly higher increase in cancer incidence than we saw with heart disease. There's a stronger relationship between poverty and income in the North Sound and cancer incidence. So we would see an increase of about 80% over the current trend, 62%, and in the best case scenario, an increase of about 55% in cancer incidence. And then we have stroke here as the other health outcome. Projection, so the modeling confidence is high, the evidence is good, data quality is a medium. So we would expect to see, there's some interesting relationships between income and poverty and stroke, along with obesity. So obesity and cardiovascular disease and diabetes, we see some interesting inverse relationships between increase in income and increase in, it's probably driving based on obesity. So we would see actually a decrease in stroke incidence in the worst case scenario, where we saw a really significant increase in poverty. Under the likely and best case scenarios, we see a slight increase in stroke incidence, and best case, slight increase. There's some interesting places. The North Sound as a whole is kind of interesting from a data perspective, especially historically. The poverty rate has been going down in some places. It's going up in other places, other counties, though income, average income and employment as a whole have been going up as well. So usually we see those as inverse. As average income and employment go up, poverty goes down, but we see a different pattern in the North Sound. So some things we'll be digging into that definitely have impact. So we'll also be adding a mental health measure around suicides, and Dennis building off of some of the data that you've been sending about real-time measures. So the last section here is social determinants. We have 3 social determinants that we're modeling: food insecurity, housing insecurity, and education attainment. Projection confidence is high, data quality is high on all of these. There's really good data at the tract level across the region. And so we would expect, as of today, or in 12 months, under the worst case scenario, about 30% of the population in the North Sound is food insecure. And that would be about 220,000 people, which is about 150% increase over current levels. Even in the best case scenario, likely scenario, we see about a 50% increase. So 72,000 new people requiring food assistance. And in the best case scenario, it's a slight change, very manageable, typically what we would see within historical year-to-year changes. But the implications, I think, for service agencies and others are pretty big. That there's going to be in the next 12 months a consistently higher volume in multiples of what they're typically used to seeing around food support. We see the same picture within housing insecurity. So confidence is high on both the modeling and the data. We would see the cost burden, so housing cost burden, those folks that are paying more than 50% of their income towards housing would increase by about double over the next 12 months. So about 203,000 people are housing insecure in the best case. We see a slight change, more what we would expect year to year. The likely scenario, we still see about a 30%, 35% increase. So 61,000 additional people this year requiring some, being housing insecure. So these are both short-term models. We do thinking about long-term education attainment, which is one of the important social determinants for long-term health and well-being. If you're able to graduate from high school, you're much more likely to be able to be employed. Your income is significantly higher, and that drives all the positive health outcomes. So projecting forward 10 years, we would expect the high school graduation rate in the worst case scenario to drop about 8%. So about 95,000 more people over 10 years don't graduate than would otherwise. And then in the likely scenario, we see the graduation rate drop by about 3%. About 35,000 people don't receive a high school degree. Best case scenario, we still see a small decrease, but again, closer to what we would expect year to year variation. So hopefully this has been helpful. Again, the link is available. You can all take a look. We're very interested in getting feedback both on what kinds of data would be helpful, what indicators are you looking at in measuring community health and well-being, as well as the social determinants that we can start to look at building some models around in the same vein of what you see today. But also curious just to get feedback around some of the projections. We are going to be adjusting the model parameters and rerunning this on a week-by-week basis as new UI claims data comes out. So in the same way that the COVID forecast can be helpful in sort of monitoring where are we based on these different scenarios, this will be useful in ensuring or understanding where we're coming at from an employment and poverty standpoint. So if we start to see continuing an initial claims increase again, that will drive up the unemployment and projected poverty numbers, which will increase the long-term downstream health impacts. And last thing that would be really helpful, other ways that we can frame this, we have talked, I think, on this call about putting some dollar figures, especially around some of the health impacts. We know what the per patient long-term care cost is for things like heart disease and cancer. So we can start to model some quantifiable numbers for what the potential additional cost burden will be for these health outcomes, but would love to know if there's other ways that we can project some of this information that would be helpful for you all as you're doing your analysis. All right, well, let me pause. I know we're a little over time. I certainly take some questions here if people have any questions or any thoughts or feedback.
Mike, I popped a question in there more for the group, and Katie Stanford's replied. We've talked about how, how to get more comfortable with using dashboards, what the role of dashboards are, and how they can be complementary to sort of a point-in-time report. And trying to think about, how do we then share or kind of really do some creative data sharing with partners across the region to start demonstrating the real-time social service needs, behavioral health needs, and that this dashboard can kind of complement that. And so knowing that it can't be it can't be a dashboard that fits for every piece of our needs, but it certainly can be complementary. So looking for kind of creative ways, and the data initiative group, just for those who are not part of that group, has been thinking about this as well. So how do we gather more information to also demonstrate what it's looking like on the ground? So, you know, chat if in the box if you think that would be helpful for your organization, and then also just more of a heads up that we're going to keep talking about that, and you know, really wanting it to kind of truth test what's going on in our communities. Well, we are a little over. Mike, do you want to just share real quick the COVID one and just our region and maybe the 90-day, yeah, and how we're doing? It's been looking different from
Yeah, I think, you know, we're starting to maybe reach a new plateau. This has been a pretty typical signature in the data, a peak through late June into July, maybe early August, and then a nationwide sort of fall off into a new plateau. Interestingly, driven by some of the MPIs in states like Arizona and Texas and Florida shutting down some businesses, and places like the North Sound, probably just due to better adherence and awareness based on the national news coverage and everything else that's been going on. So big question is going to be, you know, we see this plateau at about sort of 50 cases per day, 50 positive tests. Again, we would expect there's about 500 infections in the community. So 9 out of 10 aren't captured by testing. So does that begin to increase as the weather turns? You know, we've been in a stretch of largely really nice weather, and folks are able to be outside. So as the weather turns late September, early October, we also have the coincidence of the flu season. So that'll be the thing to pay attention to. A 90-day, based on current, you know, trajectory, we would probably see downward trajectory in the fall off of active cases as the new plateau is reached. We're down a third from where these active cases were, and then we would project at that current level with slight decrease through November. So this will start to change if we start to see an uptick in tests based on cases, depending on what that case volume looks like and where it's distributed. So this will be the thing to pay attention to. And then, you know, but right now we're probably at the peak of infections until we start to see some different trends within the modeling.
Great. Thank you for sharing that. And just if anyone's new on the call, we did put in the chat box where this one is, and then also these models are available by region and then by the 5 counties as well. Okay. We're a little over. Does anyone have any more questions for Mike? Give it a good 7-second awkward pause. All right.
Good. I like 30 seconds. It's really driving home.
Ooh, that's a good one. I might have to. That would really push people.
I know.
Okay. Well, it sounds like there's nothing else. Really appreciate Mike sharing this with us weekly, and I think some of us we're starting to get it, and we're starting to understand the use of these and start thinking creatively of how we want to use them in the future. So really appreciate it.
Great. Absolutely. And
yeah, go ahead.
Yeah, I've got a final call. I mean, we're here to improve this and really tailor it to how you all need. So if anybody's got feedback or thoughts, take your time, but really would love to know how this is helpful, what else we could add that would be make it even more helpful.
Great.
So, Mike, this is Greg.
Yeah.
One thought. I realize as you're going through it, we're getting a lot of, the worst case, likely, best case, and I'm not clear what are the assumptions behind those.
Yeah.
I think I made a comment about I'm not clear how much there's modeling or using data or projections on how, a mask acceptance or distancing acceptance or size of gathering acceptance is going to change and how these things interact. And I know that makes the model much more complex.
Yeah, and we take, I would thank you for that and for highlighting. There's a data and methods page. We're finalizing the draft of this, so it'll go, all that information around the assumptions at each level will go in here.
Great.
So you can take a look at it. I recognize.
That'll help with That'll also help with comparing models, because the differences might be based on some of the assumptions and variables that are,
Yeah, exactly. And those scenarios, would also, as you dive into that, would love feedback about how we can adjust those scenarios to be more realistic.
Yeah.
This is based on some of our national work, but, there are so many variables that can go into these, and the assumptions are fairly large. So, would definitely appreciate your thoughts or expertise on that.
Okay, thanks. It's important work.
Great. Well, I guess, Nicole, if you don't have anything else, we can turn folks loose. And just want to say thanks for taking the time and questions and feedback so far.